Hi, my name is Gabriella Vituccio, and the topic I will cover today is prejudice in police officers and how it relates to prejudice in doctors. According to a study set by Kahn and colleagues, they found that controlling the type of arrest that happened, mainly based on the level of resistance and the presence of drugs and alcohol in a suspect's system. The ratings of suspects stereotypically were negative, associated with the severity and likelihood of force for black or white suspects. This is based primarily on the stereotype of how white a suspect looks and how much force the officer felt necessary using with a certain level of force for an individual to arrest. Gaskin and colleagues examined the association between residential segregation and access to primary care physicians in metropolitan areas. They found that African Americans and Hispanics were substantially more likely than whites or Asians to live in an area with a documented shortage of primary care physicians. For African Americans, as the level of segregation increased, the odds of being a primary care shortage increases. Even while the resources in highly segregated areas were available, those physicians had lower incomes and worked with constrained financial resources, which result in decreases in the quality of coordination of care and the ability to spend adequate time with their patients and their ability to obtain special care when needed. This relates to the segregation in black community to white communities because police officers feel they need to be on high alert when they are in a different area because they do not receive the proper training and they are not confident in their surroundings. Bach and colleagues stated that identified clear patterns of differences in the training and locations of physicians treating black and white Medicare patients. Those physicians who treated a disproportionate share of blacks often have less training and less access to important clinical resources. This explains why more black patients refuse care when given the opportunity for surgery on an issue because they do not trust their doctor's abilities and resources that they have available to them. Despite having the same diseases, the same method of payment, and the same doctors, black veterans with a heart attack were less likely to receive the most advanced care available to them than white veterans for the treatment of their heart attacks. For individuals that are obtaining a kidney transplant, there is a racial and gender difference for those who have received placement on the waiting list and who receives a transplant. White males were referred to evaluation at 82%, and at 67.9% of them were placed on the waiting list for transplant or received a transplant. For black males, there was a 57.9% that received referrals for evaluation, and only 40.6% were placed on the waiting list for a transplant. For white women, there was 68.9% were put on the list to receive a transplant, when 80.3% were referred to evaluation. And for black females, only 59.6% were referred to evaluation and 40.3% were placed on the waiting list to receive a transplant. This makes blacks who were medically approved for a transplant less likely than whites to undergo each of these steps to receive a transplant. African Americans who are diagnosed are less likely than white Americans when they are suffering from depression and seen in primary care, or when they are suffering from an evaluation in an emergency room. Recent studies found that patients in psychiatric office were looked at in a quicker manner when they were black patients. The patterns that were uncovered in disparities in access to care were found that black and Hispanics have less frequent access than whites to optimal medical treatment. The explanation for these disparities might be related to racial and ethnic differences in preferred treatment or trust in the system. I believe that these health disparities exist in the country still because black and white doctors are expected to do the exact same operations without having the same equipment, which is dangerous and causes a lack of trust. There is also a lack of training and lack of understanding officers because protecting their well-being. As soon as something goes wrong, individuals are taught to call the police, but they do not listen to the instructions given to them by officers. There are some successful interventions because police officers today are being trained longer and put through more vigorous tests in order to prepare them for their fieldwork. The first step was acknowledging the lack of training and the issues that came from this and biased doctors treating individuals from different races by giving them less time and less care. For future programming, we need to help the individuals in the community in order to keep officers safe, make sure they are all connected. Giving the officers more training hours before they are let out onto the street to do their job will keep them safer and more alert and more prepared for their community that they are involved in. If you also give younger students somewhere to go so they won't be getting into trouble, a safe environment, and they can interact with police officers more, that'll cause better ties throughout the community. In order to help black and white doctors, prejudice be less prejudice. We need to make the amount of time doctors see a patient for be the same no matter color, gender, what they're seeing them for. There should be a minimum amount of time to make sure that each individual is heard and that they feel that they are heard and that they are receiving the best care possible.